Histex-Pe is a combination medication used to temporarily relieve symptoms caused by the common cold, flu, allergies, or other breathing illnesses, such as sinusitis and bronchitis. Antihistamines in this medication help relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. Decongestants help to relieve stuffy nose and ear congestion symptoms. If you are considering using this medication, carefully read the package instructions to ensure it is the right product for you. Some products may have similar brand names but different active ingredients with different uses. Taking the wrong product could harm you. It's important to ask your pharmacist if you have any questions about your product or its use. It's important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years. It is not recommended to use this product to treat cold symptoms in children younger than 6 years unless specifically directed by a doctor. Additionally, some products, such as long-acting tablets/capsules, are not recommended for use in children younger than 12 years. It's best to ask your doctor or pharmacist for more details about using this product safely. Also, avoid using this product to make a child sleepy. It's crucial to understand that these products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, it's important to carefully follow all dosage directions. Do not give other cough and cold medication that might contain the same or similar ingredients. It's best to ask the doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drops/spray. When taking Histex-Pe, make sure to follow the directions from your doctor or the instructions on the product packaging if you're self-treating. You can take this medication with food if it upsets your stomach, and remember to drink plenty of fluids unless your doctor tells you otherwise. If you're using the liquid form, be sure to measure the dose carefully with a special measuring device or spoon. Don't use a regular spoon, as it may not give you the correct dose. If it's a suspension, shake the bottle well before each dose. Don't crush or chew extended-release tablets or capsules, as this can cause too much of the drug to be released at once, increasing the risk of side effects. For chewable tablets, make sure to chew them thoroughly before swallowing. The dosage depends on the product you're using, your age, medical condition, and how you respond to the treatment. Don't increase your dose or take it more often than directed without your doctor's approval. If your doctor wants you to take it daily, try to take it at the same time each day for the best results. If your condition lasts for more than a week, gets worse, or is accompanied by a persistent headache, fever, or rash, be sure to consult your doctor. These could be signs of a serious medical issue and should be checked by a healthcare professional. Some common side effects of Histex-Pe include drowsiness, dizziness, dry mouth/nose/throat, headache, upset stomach, constipation, or trouble sleeping. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. However, if your doctor has prescribed this medication for you, it means that they have determined the benefits outweigh the potential risks of side effects. Many people using this product do not experience serious side effects. If you do experience any serious side effects such as changes in mental/mood, ringing in the ears, difficulty urinating, or vision changes, it's important to contact your doctor immediately. In rare cases, very serious side effects such as fast/irregular heartbeat or seizures can occur, in which case medical help should be sought right away. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, and if you notice any other effects, it's important to contact your doctor or pharmacist. Before taking Histex-Pe, it's important to talk to your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that could cause allergic reactions or other problems, so it's essential to discuss this with a healthcare professional. Additionally, before using this medication, make sure to inform your doctor or pharmacist about your medical history. This includes any breathing problems, diabetes, glaucoma, heart problems, high blood pressure, kidney problems, liver disease, seizures, stomach/intestinal problems, overactive thyroid, or difficulty urinating. Histex-Pe may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid activities that require alertness until you know how this medication affects you. Limiting alcoholic beverages and discussing marijuana use with your doctor is also crucial. If you are using liquid products, chewable tablets, or dissolving tablets/strips, it's important to be aware that they may contain sugar, aspartame, or alcohol. If you have diabetes, alcohol dependence, liver disease, phenylketonuria, or any other condition that requires you to limit or avoid these substances in your diet, talk to your doctor or pharmacist about using this product safely. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that children may be more sensitive to the side effects of Histex-Pe, especially excitation and agitation. Older adults may also be more sensitive to the side effects, including dizziness, drowsiness, confusion, constipation, fast/irregular heartbeat, trouble sleeping, or urination problems. These side effects can increase the risk of falling, so it's essential to be cautious. During pregnancy, this medication should only be used when clearly needed, and the risks and benefits should be discussed with a doctor. Additionally, this medication may pass into breast milk, and the effect on a nursing infant is unknown, so it's important to consult a doctor before breastfeeding. It's important to be aware of potential drug interactions that could change how Histex-Pe works or increase the risk for serious side effects. Keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with Histex-Pe include antihistamines applied to the skin, and MAO inhibitors. It's important to avoid taking MAO inhibitors during treatment with this medication, and to talk to your doctor about when to start or stop taking it. Additionally, be cautious if you are taking other products that cause drowsiness, as Histex-Pe may interfere with certain medical and lab tests. Always check the labels on your medicines and ask your pharmacist about using them safely. Remember to inform your lab personnel and doctors that you are using Histex-Pe if you are undergoing any medical or lab tests. If someone has taken too much Histex-Pe and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include irregular heartbeat, hallucinations, fainting, and seizures. If your doctor has prescribed Histex-Pe, it's important not to share it with others. Make sure to attend all medical and lab appointments as recommended. This medication is used to relieve symptoms such as watery eyes, runny nose, itching, and sneezing caused by allergies or the common cold. It works by blocking a certain natural substance, histamine, that your body makes during an allergic reaction. The daily dosage and optimal timing for taking this medication should be determined by your doctor based on your individual condition. If you happen to miss a dose of Histex-Pe while taking it regularly, simply take it as soon as you remember. However, if it's almost time for your next dose, it's better to skip the missed one and take the next dose at your regular scheduled time. Avoid doubling the dose to make up for the missed one. It's important to stick to the proper dosage schedule to ensure the medication works effectively. When it comes to storing Histex-Pe, it's important to keep it at room temperature and away from light and moisture. Make sure not to store it in the bathroom and avoid freezing the liquid forms of this medication. And of course, always keep all medications out of reach of children and pets. When it comes to getting rid of expired or no longer needed Histex-Pe, it's important to not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for the proper way to discard this product. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.